Welcome to the Motherhood Tribe. We are your hosts, Erica, Jackie, Katie, and Valerie. Come join us as we talk all things motherhood, marriage, and just plain life. We have learned the importance of having a tribe from each other, and now we want to share that with you. We're so happy you're here. Come join our tribe. Hey, Mama! What's up?
Motherhood.
We're in the okay. Welcome. We're so excited today. We're just over here giggling because we are already talking about this stuff and we're like, shoot, we need to hit record. So today we've got Jackie and Katie and Valerie and Erica. I'm Erica. And we are going to talk about what I wish I knew as a not even as a first-time mom, just what I wish I knew, right? With every kid, because we learn something new every time. So we are just going to hit them really quick, and we might have stories in between, and then we would love to hear from you through email afterwards if you guys have any more that you want to add to the list. So let's get started. What did you wish that you knew before you were a mom, before you became a mom? Yeah, I'll start. So one thing for me that I was surprised is when I gave birth, I thought that like you push a few times like in the movies and the baby comes out. And I was like pushing and about 10 minutes in, I was like, oh, he must be there. And they're like, oh, we see his head. Well, guess what? They saw his head for about an hour and 40 minutes before he actually was out. And so I had no idea that pushing could take up to an hour or 2 or 3 or however long it is. I know some people, I may just had friends that didn't have to push as much, or maybe I just wasn't interested. I think that's part of it is we're not really interested in people's birth stories until we've experienced it ourselves. But that was something that was a big shock for me.
Yeah, definitely. I remember I was pushing a lot, and that's where they get their cone heads. It's a little freaky to see a baby with a cone head, but it goes back to normal.
I also learned with my last baby that actually going through the birth canal and having the process take a little while is actually beneficial because it helps to get the liquid out of their lungs. So my baby that I just had, he came out in one push. And so he didn't sit in the birth canal at all. And because of that, he kept gagging up liquid.
I did not know that.
Yeah. And so they told me like actually pushing for longer is
helpful for you.
Just a little tidbit.
So that's an interesting fact.
Yeah.
Huh.
There you go.
All right. What's another one? Let's see. So your nipples when you're nursing hurt.
Okay, back up. I always thought that right after you push the baby out, you all of a sudden have like these huge jug nursing boobs ready to go.
Yeah. Well, your boobs are getting big just during pregnancy. And so I just assumed that was there's milk.
Yeah, the milk was going to be there. The funny thing though is one of my friends, but one of my friends had milk coming out in the shower, like white milk coming out while she was pregnant.
Really?
Oh, wow.
Yeah. Isn't that crazy? So I feel like it depends on the person. Cause like, I was the same where I had nothing. So there's a difference between colostrum and breast milk for those of us who are new moms, right? That colostrum is the clear kind of stuff that comes out at the beginning, and it's essential for the baby because the baby's stomach when they're born is the size of a marble.
Well, isn't the colostrum, I thought it was like a milky, really creamy gold.
Oh yeah. Well, is it gold colored? Or is it?
Well, or it can be like white too.
Yeah, it's kind of clear.
Clear. Yeah, I would say clear.
Really?
Yeah.
Mine has always been
wow.
Like
gold.
really milky gold.
Interesting. Wait, gold? Like it's like gold color?
Like yellowish.
Oh,
yellowish.
Yeah, I can see.
Yeah.
Like maybe like
Yellowish.
snot? I'm trying to think, like, what is that color? But anyways, kind of like a clary, it doesn't look like, but it's not like opaque, right? Like milk's like, when milk comes in, it's like it looks like white. Yeah. So your milk might come in early, it might come in late. And so be aware of that. And if by day, what would you say? Like by day 3, if you don't have milk, you should either be supplementing or like pumping as much as you can to get it out. Cause I feel like the more stimulation, the more demand, the more your body.
Right. Yeah.
produces.
Demand controls the product. Yeah. And so for myself, I knew, so after having my twins, I figured out that it took about 5 days for my milk to come in. And so then with my next child, I started pumping as soon as the baby was born, just to try to help stimulate that need. But I know that some people would also say, don't do that because then you overproduce. And so it's individual.
Go with your gut.
Yeah.
Yeah.
You'll learn about that. But
Yeah.
so whenever your guys' milk, I don't know, maybe it's different for everyone, but it's like, seemed like when my milk came in, it like came in and grew a lot.
Your boobs were
And
huge.
yes, all of a sudden. And it was like I could see them getting bigger as they were filling up. It was so strange.
So painful.
And they are like
Rocks.
so yes, so hard and so lumpy and so veiny. And it was like, could they be any fuller? Like, here, baby, drink, you know?
And
And it
can be
hurts when people
painful.
hug you.
Yeah.
Yes.
Oh, yeah.
Ah, don't hug
You just
me,
don't want anybody
it's
touching you in like
Oh
your
my
upper
gosh.
body region. Like,
Okay.
no.
On the other end, when I was weaning to stop nursing, I went to a funeral and everyone was hugging at a funeral. And I was like, oh my gosh, I wonder if these people think I have a boob job. That was how hard it was.
Because it was so hard.
Yeah.
It's really nice actually, because then you like stop nursing and about 6 months later, it's really sad.
Yeah.
It's little
true.
pancakes. I mean,
It is
I love
out of
my
it,
body. I'm
doesn't-
grateful for what it does, but I always joke that they're like little pancakes.
They'll never be as big as when you're nursing.
Exactly.
Nope.
So enjoy it. Wear
Yeah,
that
just
Yes.
part
wear
of
that
life.
fancy bra. Yep.
Yes. And along that point, that made me think of stretch marks.
Yeah.
Because not only stretch marks on your tummy just from growing, and some people don't ever get any stretch marks, but that has to do with the genes. And I got stretch marks on both my stomach and my boobs. And
Yeah.
so,
Me too.
yeah. And they go away. Well, they don't
fade.
go away, but they fade.
Yeah,
Yeah.
totally.
And so you don't really even notice them after, I guess it probably took a couple of years.
Yeah.
Some people call them their mommy stripes. And
Yeah.
So
Yeah. I
a
like
good
that.
outlook on it, you
Tiger
know?
stripes.
Yeah. Your
there's
tiger
nothing wrong with
stripes.
that.
No, not
No.
at all.
I think
So,
it's great. I mean, I know that we have this image of what a perfect body is, but I think we also need to realize that your body just did an amazing thing. You just carried and birthed a child, and that is something to be proud of. And so I've taken, I feel like, yeah, I'm kind of proud of my stretch marks. Like my kids will see them sometimes. They're like, Mom, you have owies on your tummy. And I'm like, I earned those. Like, I really earned those. They're something that you earn. They're not something that you should resent. So
yes, I know. I
Yeah.
try to talk about it with my daughter because I want her to know that it's normal to have things like that. And so then that leads to the next point that I was going to make is that sometimes you can get diastasis recti. And that is when you're pregnant, your ab muscles separate, obviously, to make room for baby to grow. And so, for example, after my twins, my stomach had gotten so big that my abs were just shot and had no strength. And so it took a lot of exercises to help heal that. And it took about a couple of years for me simply because I didn't stick to it for longer than a few weeks at a time. And so I was starting back at square one often. But
What,
have
were
to
you
be
busy
aware-
with twins or something?
I know, right?
There's no
Didn't have anything
excuse,
else
Kate.
going on. You have to steer away from certain exercises like crunches and sit-ups and what were some other ones? Doing planks.
Leg lifts or anything. That,
Yeah. And so, because that can make it worse.
I
So.
was a personal trainer a few lives ago. So we were like interns because we were studying exercise science in school, and they were two pregnant women. And even when you're pregnant, you shouldn't do a lot of those exercises, not only because you're on your back. And I guess this is something that you should know. If you are pregnant, don't do exercises where you're laying on your back, but also because of your abdomen. So naturally, no matter what, there's a thing called a linea alba, which is like the thing that connects the ab muscles in the middle. Yeah. And that stretches. It's made to stretch for pregnant women to make room for the belly. Obviously, when it gets overstretched, like yours did, Katie, because you were pregnant with twins, or, people who are petite, and I mean, you're petite too. So you're petite and pregnant with twins, but
Double whammy.
I know, right? But people who are maybe just petite or, have big babies or whatever, that will stretch out. And if it overstretches, then you have what you call we're going to call it
Diastasis
DR.
recti.
Yeah. For those who don't, it eventually will go back. And I've actually noticed now with my third, I feel like I'm starting to I can feel the gap. I remember with my first, I felt like it bounced back, but I'm sure with every kid too, the stretching and bouncing back, it doesn't quite bounce back. And so just crunches and things like that, you just got to be really careful. And Katie had a bunch of really good ones. I remember when we were working out, you had really good ones that if you just Google it, since we can't really explain the exercises without like video, if you just Google it, like ab workouts for when you're pregnant or / post birth, you can probably find some good ones just so that
my OBGYN, she told me to search mummy tummy.
Mummy tummy.
Mummy tummy. And that will give you a bunch of good exercises to do for it.
Yeah, there's some really good programs
so there you
out
go.
there. I followed a specific program and I liked it. And then that one is called Moo2 Systems, if anybody wants to look into that one. But then I've heard of plenty others that are also good options. So there are resources for you if that does happen.
On the topic of abs or bellies, I just, one of the big shocks for me, I don't know why, like I carried a baby for 9 months and my stomach was huge. But I just thought once the baby came out, it was like your belly just deflated and went back to what it was before.
I thought that too.
Yeah, I remember thinking like putting on my clothes and going home and being like, why is my belly still look like I'm pregnant? And I actually went to I'm sure you guys, others might have experiences like this, where I went to this family like gathering, and one of my husband's cousins came up to me and she's like, didn't you just have a baby? Like really confused. And I was like, yeah, he's right here. She's like, well, then why is your stomach still? Oh. And she realized as she was saying it, like, oh, I shouldn't be saying this right now. She was probably like 7 or 8 maybe. But it was just this like, yep, I know. No one else told me this happens either. I'm just a
I remember thinking that in the hospital, like the first time that I looked at myself in the mirror going to the bathroom, it was like, oh. I look like yet. I'm still pregnant. Like, is there another baby in there?
Yeah. So after having the twins, I went to a store. I think the twins were about a week old and my mom was here helping. And I went to the store and a woman there asked me when I was due. And it was actually a really good opportunity for me to assess my own mentality, because instead of becoming offended by it, which I get, it's hard when your body is changing like that. But I was actually really excited to say, actually, I just had twins and they're 1 week old. And she was so sweet. She felt bad that I hadn't, or that I wasn't pregnant, but she was so sweet. And she was like, oh my goodness, that's great. You look great. And congratulations. It ended up being like a positive interaction. Yeah, it happens.
Yeah. Don't let it bug you down.
Yeah.
And some people bounce back faster. And that's also a big shock, because I was like, oh yeah, everyone has this. And then I see like someone walk in after having a baby and I'm like, wait, what? You're in your pre-pregnancy pants already? So I think you just have to realize like everyone has their pace, right? And even from kid to kid, it's going to be different. And
true
that you just have to, again, remember you just earned that belly. Okay. You earned it. Show it around, show it off when you can. I don't know.
Yeah, just be comfortable. And to talk about the other side of the body, when you're pushing, I didn't realize that maybe some people don't get it, but I got hemorrhoids, and people don't know you're walking around with hemorrhoids. They know you're walking around with a belly, but like it's so uncomfortable, and it's just part of that healing process for it to go away. But that was one thing that surprised me ahead with both of my pregnancies.
So get yourself some witch hazel pads, because those feel really good with the hemorrhoids. And what my experience has been, whether you're pushing for 30 minutes, whether you're pushing for 2 minutes, you will probably still get them. So, and they are with this last one, I really didn't swell up because it was so fast. I didn't swell up. I didn't tear, but had terrible hemorrhoids. And that was honestly the worst part about delivery.
Yeah.
I'm sorry.
So
I know those I always had those donut things, the donut, like they're just seats. Inflatable donut seats that you just put on everything. Cause it's so hard to sit down because it's so painful. I remember being at the hospital or a checkup for my baby, and a woman was like, oh, did you do a vaginal birth? And I was like, yeah. She's like, oh, so you're probably like way better off than me right now. I just had a C-section. And I was like, yeah, you're sitting pretty comfortably on that chair right now. Like here I am like trying to like sit on the side of my bum because I can't sit flat on it. But I think there's just realization that like there's differences, and she has a scar all the way across her belly, and that's probably really uncomfortable too. And and Katie, you can attest to that. But I feel like we have to realize that one isn't necessarily easier than the other, that they all have their pros and cons.
Yes. So with my C-section, one thing that I wish I knew about was, and did you guys tell me if you had to have this with your vaginal births too? They have to check your uterus and make sure that it's contracting. And so they push on your stomach and feel for your uterus. And so, okay, well, first, was that painful for you guys when they did that? It was?
But I can't imagine having
just been cut open.
Yeah, that sounds worse.
Yeah, that was the most painful part of all of my recoveries, was when they would check my uterus, because I just had this huge incision and then they're pushing on my stomach.
To add to that, sorry, Valerie.
You go first.
Oh, I'm just going to add to that really quickly that they say, and I've experienced it, that with each child that you have, that gets more painful.
Oh.
Yeah. So the more the cramping.
I totally forgot about that.
Contracts and goes, it's more painful.
Yeah,
the more children that you have.
Because your uterus naturally contracts after birth. And I remember not really feeling much with my first, but with my third, it felt like really bad period cramps, like right after.
Oh, mine's
super
like
painful.
Labor cramps.
Labor cramps for you?
For my second. Yeah, that's actually what I was going to say before, is that it got worse.
Yeah,
by pregnancy,
with each
but
kid.
it's so painful. Like you think that the pain is over once the baby's out, but it's not.
I know.
So just brace yourself, prepare yourselves, know that it will be uncomfortable. I think if you know these things ahead of time, then it will not be as bad when you actually experience it.
Totally.
Yeah.
On the topic of postpartum, bleeding happens, right? How did I not know that I was going to bleed for 4 to 6 weeks? I guess they kind of tell you in the hospital. They send you home with some like netted granny panties, fishnet granny panties.
I actually really liked those.
I did too. They're so loosely fit. It feels so good to just,
it's
not
like
have
you're
anything tight
wearing
on
anything.
you.
Really comfy.
Yeah, when you take your outfit to the hospital that you're going to wear home, make sure that it's baggy
black
and black. Yeah, like everything that because everyone's like, oh, I'm going to go home in this cute outfit. And then guess what? It's not going to work. So yeah, I brought home.
That's the last thing on your mind after you have a baby.
Yeah.
That's hilarious. I'd totally forgotten about that, because with my first baby, I just was thinking, I'll just pack light and I'll wear out of the hospital what I wore into the hospital.
Uh-huh.
And I was wearing these gray yoga pants. And I just remember when I was leaving, you could totally see like the pad and like every line of the granny panties. And I just was thinking, oh my gosh, this just looks terrible. I wish I'd packed something loose. So that is a really important point to make.
Yeah, totally.
Okay. Speaking about the pad, one thing I discovered during my first postpartum experience, my mother-in-law got baby diapers, like newborn diapers, and filled them with crushed ice. And I used those for like ice packs, and they absorb for like the blood and everything.
Mm-hmm.
That's
amazing. They felt amazing. So she stocked my freezer full of newborn ice-filled diapers.
They did that at the hospital. I was like, can you bring me one of those diapers with ice? And I know you have them.
Yes, they do the trick.
That's awesome.
I've also heard the adult diapers.
Yeah,
are
good.
Great. Yeah, I've never
Instead
used
of a
them,
pad.
but I've heard, that instead of a pad, that they're awesome.
Pads just don't cut it, I feel.
Yeah. I did like the pads that the hospital provided, and you can ask for extra ones, because if you want to go home and have some there, then just ask for some extra ones, and usually the nurses will help you out with that.
They're
and
always
so I
so
asked
generous.
they're just trying to help you. I love it.
Actually, stock up. That's another tip, is like stock up on everything at the hospital. I opened all of the drawers, and I stuffed my duffel with like the diapers that they have, and like the newborn
don't care.
And, I mean, you're paying for it. Yeah,
yes.
You're paying a lot of money for it.
In regards to the ice packs, so with C-sections, those are really helpful on your scar too. After my third child, my scar was my incision burned, and I learned that it was the nerves reconnecting, and so they were refiring. And
Wow.
so it burned. And so I ended up using ice packs on my scar, and it helped a lot. There are some ice packs that I loved. You can just get them on Amazon. They're perineal ice packs, and they just activate by shaking them.
Oh, yep.
And so it was just really easy. And so
Good to know.
loved those. All right. Something else that in regards to breastfeeding that we haven't mentioned yet, I wish that I knew that your nipples, so we talked about how your nipples will hurt, but they can also bleed. And I even felt like my nipples, part of them were like falling off and because they just get raw. And so I was really freaked out when they were bleeding. And I was so worried that my babies I was worried that they would drink blood. And so I talked with my pediatrician about it, and they said, don't worry about it at all. It won't affect your baby, and your baby will be just fine.
That reminds me of Jackie. Are you thinking about?
So my baby did drink my blood, and
oh, that's right. It was a lot, huh?
Yeah.
Like it freaked me out because he spit up all over his jammies, and it was blood. It was red all over his jammies, and I was freaking out because I thought that it was his blood. And so like I saved the jammies, I put them in a little Ziploc bag and went to the pediatrician the next day, totally freaked out. And the pediatrician just said, "How are your nipples?"
Oh,
because
smart.
That's your blood. It's not your baby.
Oh my goodness.
But he's, they're fine. You don't have to worry about it hurting them, I guess is the point.
And your
Sorry, what were you gonna
nipples
say?
go back to normal after.
Yeah,
they
it's
get
like I
used
would say
to-
like
yeah.
2 weeks. Do you think? I feel like 2 weeks
Yeah.
is like where you start to, they kind of callus over. They don't feel as painful. So like if you're bleeding, your milk is a little bit pink, you're hurting, like try and use lots of lanolin, or what are some other ones that people use? Like
There was one
cream.
when I was
Coconut oil.
Yeah, there was one I
Coconut
was
oil.
prescribed. If it gets really bad, there's something you can put on. Actually, mine were in pretty rough shape for about a month.
Okay.
So it can
2 weeks
Yeah,
to
mine were
varies.
for a while.
Yeah.
I know, and Jackie, your babies would always crack them, like they'd bite down, and so you'd have them even months later. And that happens. Like, I mean, it's not like you're good, you're in the clear. Your baby bites down funny or he pulls funny, and it's like you start right back over again. But the healing process, I feel like, is quicker the further along you get.
Yep.
And I discovered also at the beginning, when you're just so sore, these beads. This is it's called, it's from Lancino, but it's therapy pearls, 3-in-1 breast therapy. And these are so great. You can heat them up or freeze them.
Nice.
And it feels so good when you're engorged. And it's also interesting, I got engorged with my first 3 children, and then with the 4th, I didn't.
Huh.
Yeah, it was really strange. Everything has been different with the 4th. So that's something else to know. I wish that I'd known that things vary. You think that you have something figured out, and then it can be totally different. Like, I didn't know that, labor can go so fast, because my first one took all day basically, and then my second one was born just within a few hours. And so it just varies.
I know, isn't that like the story, like the theme of motherhood, is that everything is unpredictable. Like once you think you've got something, like surprise, here's a new challenge for you.
Something that came to my mind that has stayed with me, and I tell myself all the time, be grateful for it today, don't expect it again tomorrow. And I think that is so important in just motherhood in general, because you'll think like, oh, my baby is now sleeping through the night, this is incredible. My 2-month-old, he was sleeping 10 hours a night, and I thought, this is amazing, I've never had a baby do this. And then once we hit 4 months, he started waking up 3 to 4 times a night again. And so you can get frustrated and think like, man, I thought we had this figured out, things were so good, and it totally changes. And so if you can that's helped me a lot to have that perspective of, okay, like he went to sleep and he slept through the night, and I'm so grateful for it, but I'm not going to expect it again tomorrow, because then I'll be frustrated when it doesn't happen.
Exactly.
That
It's
is
all about
excellent advice.
Oh, so one thing, zip up, why can't I say this? Zip
Footy
up
pajamas.
Are like, I hate snaps. Snaps are the worst, but zip up jammies are really nice. And actually I was just babysitting a 2-month-old or 3-month-old last week. And he had zip up pajamas from Old Navy. So I guess this is like a new thing. But the zipper starts at the bottom and zips up open. So like you zip it closed from the top down. So then you can zip the bottom half and change the diaper and still have the top half intact, which I thought was really nifty.
And along with jammies, get the jammies that have the baby mittens on them already connected, that just fold over, especially for your newborns, because the mittens don't ever stay on. And so the ones that are already built in, those I put my baby in those every day.
Yeah, because otherwise they wake themselves up scratching their faces. And 1000% agree.
Some other products that I've loved are the nose Frida.
Mm-hmm.
That one is so helpful because babies can't blow their noses. And it's so sad.
And so satisfying. It is so satisfying.
I gagged through the whole thing.
I know Katie is a gagger when it comes to snot. And somehow she always ends up being the one that has to clean it.
Yes.
I'm like, Katie, I can do it. She's sitting there like gagging as she's like wiping something.
I got this.
It's not even her own kid. I'm like, Katie, I got it.
So look into the nose, Frida.
Your hair will also fall out around 3 months postpartum.
Oh, very good point.
Yeah. And you may get a little bit of balding around the front. So I usually cut bangs because it helps me to not feel bald.
I also, oddly enough, got hairier after I gave birth. Like, my hair got really, really thick, and like my back hair. I don't even have back hair, but like in your lower back area, some people have hair like that got really thick, and I noticed it just like on my body. Weird. I don't know.
That
like
happens
on my
to
face
me during pregnancy.
Okay.
Yeah. That happens to me during pregnancy as well.
It might be like a surge of hormones right after birth, or like pregnancy and birth. Cause then like it goes away after a few months, and then like I have loss of hair in like the front area. So anyways, you'll grow hair, you'll lose hair, hair's everywhere basically.
Yes.
Going back really quick to just back to our breastfeeding nursing situation, you do leak a lot early on because you're trying to adjust. And so I was working full time with my first, and I would be in meetings and all of a sudden like look down and have like huge wet circles on my shirt. So find products like nursing pads and stuff. I actually like the cotton ones. I don't like the disposable
silicone
ones. Or the disposable ones, like they make me itch. I feel like I'm wearing like a maxi pad in my bra, but sometimes I would leak through my cotton ones. And it happens obviously when you're letting down, when it's almost time to feed. It also happens if you hear a baby cry, and anytime you're releasing oxytocin, which is like the bonding hormone. So also when you are bonding with your husband, it may happen. So when we were intimate, at least early on, I would wear a sports bra because otherwise I literally spray milk everywhere. So those are things to kind of keep in mind, that like you're going to spray sometimes. And sometimes it's just nice to have like nursing pads and a bra.
Or your baby sleeps a little bit longer and you wake up all wet.
Yeah, and there's like a puddle.
Oh, yep. You're too full. It just comes out.
Yes.
And on the topic of letdown, I wish that I had known that it felt like pins in
yes.
Like, I don't almost like that. Needles in
it's like a
your chest.
tingling.
It's like this weird tingle feeling, and you can feel the milk. So letdown, that was another thing that I didn't know about, is when your milk just, how would you describe it?
Goes from storage
to just flows. Yes, it flows into the forward milk ducts.
Yeah. And it always kind of is like, oh, it's like that feeling when you go on a roller coaster. It's not, but like the way that I react to it is like when you go over that
the butterflies in your tummy kind of
you're
a
like,
thing.
ooh, like you feel like you just kind of have to like go with the roller coaster for a minute.
Yeah.
And somehow I didn't know that you let down on both sides. Like I would have to hold one
side. So you'd start leaking on one
I'd
side while you're nursing.
Yeah. Like I'd get all wet on the other side. So like make sure I stuck a pad in there, or even like a that one. Sometimes I just stick a birth. It's called the Haka.
The Haka.
Yeah, the Haka is awesome because it just suctions on, and so you can put that on to the side that you're not nursing on, and it will just collect milk.
Yeah, that's smart. I know. I always just hold a bottle on one side while I'm nursing on the other, because you're just like, do you?
Yeah.
Or you can just put pressure on it, and it'll keep it from leaking too much. Yeah.
So with breastfeeding, I didn't realize that it was a challenge or why it was a challenge to people. I just thought if you wanted to do it, you just decide to do it. And what I learned quickly with my first is that there can be many different challenges, and learned what lip tie and tongue tie are. And I wish I had known about that in the hospital, because I feel like I could have been a stronger advocate for getting our nursing
Interventions.
success. Yeah. Like I feel like it would have just put me that much farther ahead. But instead I like wasted 2 months just not knowing, and just having a really upset baby and everything. So for anyone listening, it's super helpful to know this going into it. You can Google it. There's tons of pictures. There's also varying degrees of the ties, but if their tongue is attached too far forward and they have a hard time lifting their tongue, which sometimes you just got to get your fingers in there, but you can tell right after birth if they are tongue tied. And with their lip, it's their top lip that is attached to the front gums. Towards their teeth, like all the way down. So there's, you could even be lip or tongue tied a little bit and still have difficulty nursing. And that's what we had. We had a few other problems, but they will just clip it right in the hospital. And had I known that, I could have pushed for it, but I didn't. And so we ended up, he was just too old, I think, for them to clip it or something. I don't know. Again, I was undereducated for all that back then. But we ended up having to do a laser surgery, and the procedure broke my heart. I was there watching him, and the healing, it's pretty, I have to do like stretching to make sure it doesn't reattach. It broke my heart, and it's just a big mess. And had I known about it earlier, I feel like I could have saved him all the torture. I don't know that nursing would have worked, but I wish that I had lip and tongue ties on my radar.
Yeah, that also, I've heard that it can cause, like, depending on the severity or the type, that it can cause like gassier babies because they get air in when they're trying to nurse. And so if your kid's really colicky and you're trying to figure out why, I actually didn't realize with my third, he actually had a little bit of a lip tie, but by the time I figured it out, because he had nursed fine, like babies with lip and tongue tie can even nurse pretty normally, but they might just have like gas issues. And he was quite fussy, during some different phases. I think his isn't that severe, and so we never got it taken care of. But I realized it like a year into having him that I was like, oh, his lip actually kind of looks different. And I never felt like he had a very deep latch. Like I feel like all of my other kids, like you couldn't see the nipple because it was like all in their mouth, like the colored part of your nipple, and that's a really good indicator that they've got a deep latch and that they're sucking. But people, like babies with tongue and lip tie, oftentimes have a shallower latch. Which then is more painful for you as a mother because it's, pulling on the skin more and stuff. And so, just so much about just being educated on that. And I don't feel like first time mom, like, I mean, you're not even, nursing isn't even on the radar until you the baby comes out,
You just think it happens. It's natural.
Yeah.
That's what I thought. Yeah. And they have lactation consultants that come see you, but they were so not helpful. And I didn't know what to push or how to push, or I didn't, you just kind of blindly follow the advice, like, okay, we'll get this, I guess. But just if something's not feeling right, just trust your gut and just ask for more until you understand it or until you're comfortable with it, because
just be aware and advocate for yourself. You don't have to blindly just take everything that's given to you. Like if someone comes in and
use your resources.
Use your resources, but then also be aware.
I also recognize that it may vary from hospital to hospital, but I was told this last time that all of the nurses are also trained with helping moms latch and with breastfeeding. And so we had to stay an extra day with my last baby because we both had a fever. And so they just wanted to monitor us. And I struggled with breastfeeding with my first 3 for quite a while. I kept with it, but it was really, really hard. And so that was something that I was really nervous about. And I decided to use that extra day to just practice. I mean, obviously that's what we're doing, right? We're feeding our babies all the time, but to try to give as much help as I could. And they were so helpful, just letting me know, hey, all of us are trained to help you. So it doesn't have to just be the lactation consultant. And so anytime a nurse would come in, I would just try to ask for feedback, or how is this position? Can you help me figure out how to get him to have a deeper latch? Things like that. And by the time we left that day, we had improved significantly. So I was really grateful for that.
Those are good questions to ask, because sometimes as a new mom, I don't think you know what questions to ask.
Exactly.
And so you could just simply ask for advice and say, we're doing it this way. What do you see? And
Mhm.
so,
Am I doing it right?
yeah. And on the topic of nursing as well, I wish that I had known that babies can be sensitive to different foods that you eat. So what you eat impacts what they are getting through your milk. And I think that I look back on it and I think that my daughter, she, I think, was sensitive to something because she was very, very fussy and always crying, and it was like her stomach was upset, or not upset. I think it was bloated, and like she was in pain for probably the first 6 months of her life. And so that was really difficult. But because I didn't know anything else, I just thought that she was a fussy baby. And then I wish that I had known some other things, like maybe she was sensitive to dairy, or maybe she was sensitive to the foods that I was eating, because I wasn't careful at all about what I ate. And it just didn't dawn on me at all that could connect to her fussiness. And so,
Yeah, with my first two, I had to go off of dairy because they were, I mean, some point you just are willing to try anything because your baby is so fussy and you can't figure out what's going on. And my first, especially, he would claw me while I was nursing him. He would claw and arch his back. And so I figured out that he had two things going on. He had acid reflux. So the arching of their back is a telltale sign of acid reflux. So he had that, but then also the dairy. So once I went off dairy and had it out of my system for, I think, a week he significantly improved. And it lasted until about 6 months.
that's awesome.
Yeah.
So one thing that I also realize is that I think as a first-time mom, we kind of feel like we have to have all the things, like a swing and a bouncer and a swaddle and a crib and a pack and play and a changing table and a changing pad and a wipe warmer and a bottle warmer and, like everything.
The whole store of Bye Bye Baby.
Yeah. And you put it all on your registry and you're like, okay, I've got everything. And then you realize your baby hates the swing, or your baby hates the bouncer, or your baby hates being swaddled, or he loves being swaddled, or it's so different from baby to baby. So my greatest advice, I think, to moms is like, hold off on that stuff. See if you can borrow it first. I feel like that is a way to test it out to see if your baby likes it. Like my first baby was all about swaddles because he would always wake up. But then I tried with my second and he was not having it. So I have like all of these sleep sack thingies that I saved because I was like, oh, all my babies are going to love these. And I haven't used them since my first kid. Or like, I felt like my kids all like the swings, but I know other kids don't. And there's swings that swing sideways and forwards and backwards. And maybe they like one way and not the other, or, whatever it might be. So don't buy everything. Buy the essentials. You need a car seat. That I would say that's an essential.
Diapers.
Diapers, wipes, wipe warmers. Like you don't probably need, onesies, somewhere for them to sleep, whether it's a pack and play or a crib. But otherwise,
you can keep it pretty simple.
Yeah. You can. Yeah. People do it all over the world without all the baby gear.
Exactly.
Yes. Babies just need to be clothed and fed and to be able to sleep. And another tip is buy used. Mm-hmm. There are so many secondhand stores or
consignment sales.
Marketplace. Yeah. Consignment sales.
Well, and with Facebook Marketplace, you can meet fellow moms that way and make friends.
There you go.
There are people I've bought from that I'm like now friends with them on Facebook, and and so it's a great way to meet other moms in the community.
Yeah. On the topic of products too, I had a lot of anxiety with my kids during their sleep. For some reason, I was just really anxious that they would stop breathing or something like that. And so the Owlet monitor, and there are other monitors out there, not just the Owlet brand, but that's what I used. And by the way, we are not at all sponsored. So
we're not being paid.
No,
we would like to be paid.
Maybe someday. But these are all just simply products that we've used and we get our stamp of approval.
Another product that I feel like was helpful living in a smaller space was having a sound machine. Not so much to put them to sleep, but to drown out noise outside of their room. So my kids, we live in a tiny apartment in New York City. They're older now, but having a sound machine kind of by their door helps if we're talking out there, in the living room or something. It helps drown out that noise so that they can sleep. we'd like to do the crickets one. The white noise kind of freaks me out, but
We do the ocean.
the ocean. There you go.
Can we talk about how I was surprised at how much you love them when they come out.
Yes.
Like you just immediately love these babies. Like you finally get to see their face and you felt attached to them, but to actually hold them and see them and hear them, it's like, oh, it's a whole new level.
I know every time I watch someone's like birth video or read their birth story, I'm always in tears because I just remember that feeling of having that baby in your arms and being like, oh my gosh, I worked so hard for you to get here and now you're finally here. And they're just perfect. Everything, every sound they make, the way they breathe, their little noses, the way they cough or sneeze or, their
smell.
They smell so good. Yeah.
On that same note, I remember feeling like when I was pregnant with my second child, I was worried that maybe this is a weird thing to worry about, but I was worried that I wouldn't love him as much as I loved my first.
Yeah,
I don't think that's weird at all. I can totally relate.
Same, yes.
Did you feel the same way?
I did.
Was honestly so worried about it, but as soon as he came out and I met him, he filled a space that was just for him, and it was a really, really tender experience for me just to realize just our ability to love is really infinite. I think
it grows,
and it grows. Yeah.
I want to point one thing out that was a little bit of a different experience for a family friend of mine. She had been told this, and many people had expressed that as soon as their baby was born, they felt this way. And she was really taken aback because she did not feel that way immediately. And what she discovered was that she needed to develop that relationship with her baby and that it happened over time. And so it wasn't this hopeless circumstance. It was more she felt like she would have this overwhelming joy and overwhelming love, but she was surprised when she didn't feel that. And that relationship developed over time. And so although this has been many people's experience and where you can just experience that sweet joy in the very beginning, if you don't have that experience, I hope that you can know that there is still opportunity for that relationship to grow. I guess I just want to like point that out a little bit that
I'm glad you did.
It might be different for different people, just like everybody's own experiences like that.
I actually got advice from a friend that said the same thing. She was like, you might not love your baby like right off the bat, because she said that she expected that and she didn't get it either. So if you're feeling that, there's nothing wrong with you, right? And I feel like dads feel that way a lot. I know my husband says that it takes him time. It takes about a month or so for him to really feel like he has a relationship with a baby, because I think it's easier for women because they carry it. But we talk about giving birth and stuff, but a lot of mothers are mothers through different means than just a vaginal birth or a C-section. There's adoption and there's foster care and there's surrogacy and there's so many different things. And so I think it can be different for everybody. Either way, it's a blessing to have in your home, and it stretches you in ways that you wouldn't have ever expected, but it makes you a better version of you as you grow into motherhood. So
yes, along these same lines is that you're completely new to this. I wish that I had a perspective of recognizing that your baby is brand new at this, and so are you. And so it takes time to learn. Your baby's learning how to eat. You're learning how to feed them. Your guys' experience is the same. You're at zero from the beginning with each other. And so give yourself some grace and be patient with your baby, and you will figure it out. It might take time, but you will figure it out.
I feel like this is a great place to kind of finish our discussion. Obviously, we could go on for days and days, and we'd love to hear from all of you listeners some of the things that you wish you knew, and we can maybe talk about them again in another episode. But thank you so much for listening. And if you are an expecting mom, we hope you the best on your journey, and hopefully some of these facts have helped you. And even if you're not a first-time mom, hopefully maybe you've had something that you can take away. And we're so grateful that we could talk about this today. Thank you so much for tuning into the Motherhood Tribe. We